what homeopathy is
Mm.
and how it differs from traditional veterinary medicine.
Homeopathy is a science that was discovered or rather founded by Samuel Hahnemann in Germany in the 1700s. It is a system that says like cures like.
How do you approach issues like aggression, anxiety, or depression?
Good question. Pet parents passed away or they were in isolation and the pet couldn't access and the pet stops eating. These are signs of minor depression. If a pet loses a pet parent or why just a pet parent, even a companion animal, we see cases of them having depression.
How can pet parents find a qualified homeopathy doctor for their
Go to my
pets?
website.
What are the most important things pet parents can do at home in their daily lives, to support their pets' long-term health?
Invest time, energy, effort, and create an ecosystem to provide the animal a good diet.
If you could give one piece of advice to every pet parent, what would it be?
Focus on the food and adopt native breeds if you can. They have much healthier, much stress free lives for themselves and for you.
Welcome to Tales of Tales with Manisha. Today we are talking to Dr. Ashima Nath, who is a highly sought after homeopath renowned for her compassionate and effective treatments. Practicing in Thane, Maharashtra, she has successfully addressed a variety of conditions in animals, including viral warts in street animals, with homeopathy alone, avoiding the situation of surgeries. Her expertise extends to treating both physical and mental illnesses in dogs like aggression, anxiety, and depression. Dr. Nath has undergone training in canine behavior and body language to enhance her treatment approaches. She has treated not just dogs but also cows, turtles, and many other animals. Hi, Ashima.
Hi, Manisha.
You worked with a wide range of animals like dogs, cats, turtles, and cows also. So, could you tell us any one success story which really highlights the impact of homeopathy in treatment?
First, I'll elaborate on that list that you talked about. So there are cows, horses, donkeys, monkeys,
Oh,
birds, turtles, tortoises, and of course cats and dogs, and rabbits and squirrels also. So we worked with a wide range of species, and not to forget humans, of course.
of course.
So we worked with all of them, and particularly a few cases do stand out in mind. There was a cow in a remote village in Chhattisgarh called Rajnandan Gaon. I think that's the name. She had a severe epilepsy, and the suggestion from vets was to put her down. The person reached out to me, and I remember asking him to give a handful of pills to the cow each time. And thankfully, till date, the cow called Lado, I think, is absolutely fine. So that is one that struck to me. There was another wildlife rescue in Calcutta that was a civet cat with a paralysis of hind legs due to injury. Again, that one has made a very good recovery. And there are a bunch on the street that really, are very close to my heart because there's nobody really doing much for them. And when rescuers reach out to them, we are able to help with skin issues because skin issues, while they sound very benign and mild, it's one of the topmost reasons that animals are abused or hit or shooed away. So for us, that is important because we are able to help someone that is really not in a position to do much about it. So those stand out for me particularly as an individual.
Can you briefly explain what homeopathy is
Hmm.
and how it differs from traditional veterinary medicine?
Sure. So homeopathy is a science that was discovered or rather founded by Samuel Hahnemann in Germany in the 1700s. It is a system that says like cures like, and where we use highly diluted versions of various natural and mineral and other substances to treat disease. Now, in the way that it differs from conventional medicine, mainly the difference is that we use the body's immune power to counter disease. Inherently, all of us have the power to fight disease, right? Like, it's not every day that all of us fall sick. So, we use that ability of the body and support it to counter disease. In this, the main thing that happens is that there is a longer lasting cure, and there are no side effects. So, by definition, we are different from conventional medicine in that sense. Having said that, and we will talk about it later, I'm sure, these systems complement each other, they are not against each other. When you say of veterinary medicine or conventional medicine, even for humans and animals, allopathy and homeopathy ideally work well together in chronic disease or in longer term issues.
What type of conditions in pets, animals largely, respond well to homeopathy? Like, for example, are there specific diseases like arthritis or skin diseases which respond better than other diseases?
Actually, it's easier to answer what can't we treat, okay?
Okay.
Because that is a smaller subset, and there we have lesser, limitations. So, except for the absolute emergencies, meaning either there is bleeding or an accident or cluster seizures or an animal has fainted, or there is a purely surgical issue like a herniation of some kind in the abdomen. Other than this, we play a good role in
Treating all
almost
kinds.
all diseases. In some cases, we are good at substituting conventional medicine. For example, chronic diseases like arthritis, skin issues, these are common. Migraine, animals don't have migraines, but skin and epilepsy and those sort of things, we are often able to avoid, minimize, wean off allopathy. But in case of certain emergency or rather more acute clinical conditions like say a tick fever or a parvo or a distemper, we do well to complement allopathy, because like I said, these are diseases where the immune system has taken a major hit, and we are able to support the immunity of the body to help heal faster. So in certain issues we are better off complementing, and in others we are good in terms of also substituting.
What kind of research or any kind of case studies support homeopathy for pets?
There are various books published on this. We ourselves, honestly, have been at the forefront of doing this work, um, but we have not been so great at documenting it. But I encourage it, like, and welcome anybody who wants to, document this work that we are doing. And I think a large number of holistic veterinarians, if you look at the Western world, there are many, also advocate homeopathy and use it along with conventional medicine for their patients and pets. So there is enough evidence to show that it works, but is it documented and structured in a place? I don't think so.
Mental health in pets is often overlooked, or usually pet parents are not able to identify it. So how do you approach issues like aggression, anxiety, or depression?
Good question. Um, See, all living beings have emotions. It is uh, it is one of the major reasons that we bond with animals, that they are emotional. Unconditional love bonds us to them. Just like us, they also suffer from mental health issues. Often we will hear that, a pet parent passed away, or and COVID gave us a lot of those examples where pet parents passed away, or they were in isolation and the pet couldn't access and the pet stops eating. We know this very commonly, that if the pet parent is away, they will not eat. So these are signs of minor depression. If a pet loses a pet parent, or why just a pet parent, even a companion animal, we see cases of them having depression. I have seen cases in many houses where the primary caretaker was a servant, and the servant changed and the dog fell sick. Okay, so this is a common thing we see across the board. As far as aggression is concerned, specifically, I do want to highlight that it may not just be a behavioral problem. Many times, what happens is there is underlying pain, and that comes up as aggression. So we've had cases where we have worked with severe aggression cases and actually found arthritis or some joint problems or a muscle pull or a ligament strain or something which is causing severe physical pain, even pancreatitis or gut issues. Wherever the animal is in pain, they will snap. Okay, so aggression is a tricky area to work in. So usually what works well is to have a vet, a homeopath and a behaviorist that can help you solve this.
Okay. So, what are some common health issues in pets today?
Anything that comes out of an overload of chemicals is a problem. The way I look at it, currently everything in the environment of the animal is laden with chemicals, preservatives. Look at first up the food. A lot of pet parents still use uh, kibble and
Yeah.
processed food. The second is their shampoos, the local applications. While we have moved on to using organic and natural for ourselves, we've not learned the same thing for animals. The third is, of course, tick and flea medication. And fourthly, one frequently overlooked area is the chemicals that we use in our houses for cleaning floors and
Yes.
laundry. So many times we are able to eliminate or reduce the incidence of skin issues or even slipping on tiles, etc., by just modifying these factors. So this, according to me, is causing a lot of disease, as is the fact that you have many households where you have simply outsourced the animal's care. So my suggestion to people usually is be involved even if you have a caretaker. So these things together, I think, are the main causes or the issues that are triggering diseases in animals, at least the companion animals that we have.
So, since you mentioned tick and fleas, what are some natural things which pet parents can do to prevent these? Because the solutions I also know as a pet parent is some kind of medicines which is given to them at regular intervals.
The way I explain it is, look at a street dog.
Hmm.
They also have ticks, they
Yes.
also have fleas. None of them is dying of tick fever, right? Focus on building the body's immune response. And then, if you have that odd tick or flea, it won't matter.
Okay.
One. Having said that, from a personal hygiene point of view, also because we coexist with these animals
Yes.
in our spaces and nobody wants to have ticks and fleas crawling around,
Yeah.
what there are a few things you can do. Again, I keep coming back to the diet. A good meat based, grain free, mostly dairy free diet, I think, is the cornerstone and the turning point for any animal's health. The second you can do is there are additions you can make to the diet, like apple cider vinegar, small quantities of garlic, some spices that are naturally pest repellent.
Oh.
Okay. The third you can do is to use again neem and natural products for bathing and to keep their skin healthy. You can also use apple cider vinegar locally to apply, and that helps quite a bit in turn changing the pH of the skin and not making it that um, fertile place for ticks and fleas to breed. And of course, you can use homeopathy to some extent. There is not so much oral medication options. As a few companies are selling stuff, but I've not seen very great results come out of using oral medication for tick and flea. It's a mix of diet and local applications, and of course, a stress free environment, because a lot of times we'll hear that the pet was in boarding and it came back with a lot
Yeah.
of ticks and fleas.
Correct.
This is also because the animal was stressed out, that thing. I mean, the stress also plays a role in that tick infestation. Okay. So, yeah, a mix of all of these somewhere will give you the answer. Of course, the drugs that are there in the market exist for a reason. So, if you have a severe situation of flea infestation or tick infestation, yes, those products are meant to be used. But as a preventive, I don't advocate the use of any of these.
Okay. Some people say homeopathy is just a placebo. You know. So, what does science and clinical experience say? How do we know it works?
How do you give an animal a placebo? First of all, that concept doesn't exist. Secondly, and importantly, how do we prove, even in human beings, that a medicine works? You do clinical trials using animals. That's what you do in early stages
Right.
of all clinical trials. I'm doing exactly that. So, my answer to most of this is, please explain to me, how will I give a placebo to a street animal? So the proof of the pudding lies in the eating. The thing is, it is working. You come and witness the work we are doing. The results are there for everybody to see. And that's really the answer. In fact, even for the human homeopathy, I say this is the proof that it works.
Yeah.
because I can't possibly, jig an animal's mind to say something or treat itself or do stuff.
Okay. Oh, it's a common belief that homeopathy takes a long time to show results. So, what is your experience, and is this a myth, or it does take a long time?
It's not a myth, first of all. It is a relative scale.
Hmm.
Okay. If you're asking me, like, and I was speaking about this earlier, if you're talking of a true blue emergency where there is bleeding or cluster
Mm-hmm.
seizures, that's really not even the time or space for homeopathy. But will it take years to work? No. So it depends on the time that you've suffered from the disease. If you've suffered from something for 3 years, give me 3 months to resolve.
Hmm.
If it is a diarrhea or a cold or a viral fever, I can't ask you for those kind of timelines. So if you've suffered from it for 3 days, at least give me a day to resolve it. So it's sort of relative to what the disease is and what other treatments have been done in the past. And I say that specifically because, we have cases of skin issues in animals that have been so severely immune suppressed by giving steroids and other much stronger immunosuppressants that these are habit forming drugs.
Hmm.
Okay, they alter the body's neurological pathway for itching. That is how these medicines work. So for me to reverse or wean off such medication will also take time. So it's not just about how long will I take to show result in terms of the homeopathy alone. It is that other systems of medicines are involved and I need to sort of undo the work that has happened there also. So it's a mix of many things. Having said that, I do treat cases of parvo and distemper,
Hmm.
etc. And there I don't have the luxury of time. My
Yeah.
medication has to work instantly, and it does.
Hmm.
So, uh, it really depends upon the disease and the age and many other factors that go into how long will a disease take to treat.
Okay. Is it safe to use homeopathy alongside with the conventional veterinary medication and treatment?
Absolutely. Um, in fact, in many cases, we also advocate it.
Okay.
Um, I'll give you examples. See, I was speaking earlier, right? In certain cases, we are able to substitute allopathy medicines. In certain cases, we complement it well. So, by definition, there we are working with allopathy. And you'll be happy and surprised to know that we work with a large number of vets across India who, in fact, refer patients to us. And they also know that in cases of kidney issues, liver failure, repeated tick fever, skin issues, homeopathy complements allopathy quite well. So there is no harm in giving both together. In fact, we ourselves have also launched an offering recently where we have an empaneled vet, and he will help us decide, which are the milder medication, what is less harmful for the animal, and can we use that instead of using, again, I use the example of steroids because they're well known, or other immunosuppressants. Can we use lesser allopathy and more alternative medicines, herbal medicines, and massages, physiotherapy? Can we do all of this and improve the quality of life of the animal? We certainly think it's not just veterinary science and homeopathy, it is veterinary science plus all alternative systems,
Hmm.
which has to work in tandem.
So, are all homeopathy remedies created equal? Like, how do you ensure that the dog is also given high quality, ingredients and treatments?
It's a fair question. Actually, today, just about anybody calls themselves a backflower practitioner or a
Yeah.
hobby homeopath. So, the answer really lies in working with experienced, qualified, and registered
Hmm.
practitioners. Uh, just like any other doctor, I have studied 5 years of medicine and done 1 year of internship and dissected bodies and everything. So, I know what I'm doing. Where I don't know in the animal world, where I don't know what I'm doing, I'm happy to reach out to somebody and ask. But where you have somebody who just was, so to speak, a mom and pop shop,
Mm-hmm.
then I think you need to question a little more deeper as to who you want to entrust your animal's care to.
Hmm.
As long as it is a qualified, registered person, I don't think there can be harm with homeopathy. Uh, in terms of are all remedies created equal? Not really, of course. You have to select the right ones, and you have to work with decent manufacturers to source your own pharmaceutical products. We also are in the process of launching a few of our own over the counter products. For example, for hematomas or pseudo pregnancy or mild skin issues, those will soon be available on internet portals, and you can just buy them off the internet.
Okay. Since you mentioned Bach flower therapy, could you explain a little bit on that? Because there's a lot of information on that trending on internet nowadays.
To be honest, I'm not an expert in that area, so my comments will be limited to that. Um, we use backflower more as a complement to our own work. I am not a backflower practitioner itself, but in cases of severe anxiety, etc., I have used rescue remedy. But then again, I am not well versed with the individual remedies or where to use only those. That is not my forte.
Okay. Many pet parents are curious about holistic nutrition for their pets. What are your top recommendations for a balanced, natural diet that supports both physical and emotional health in pets?
So the way I explain this to, I mean, and nutrition forms a large chunk of my consultation calls also, because I believe until you set the diet and the nutrition right, no matter what medicine you give, you won't make a breakthrough in the case. So how do you really decide what is the right diet for anybody? I say look at nature. You and I can be wrong, vets can be right and wrong, and big pharma companies can be right and wrong. But nature is not right and wrong. So if I ever have to ask you, मनीषा हम गाय को क्या खाना देते हैं, आंसर विल ऑलमोस्ट ऑलवेज बी घास देते हैं.
Correct.
ठीक है. लेकिन द फैक्ट ऑफ द मैटर इज दैट यू गो टू एनी मॉडर्न डेयरी टुडे, कोई घास नहीं खिला रहा है.
हाँ.
They are feeding corn waste. And then we say grass fed cows are better. Okay. Inherently, we are acknowledging that natural diets work. Okay. आप जू में जाओ या जंगल में जाओ, द लायन इज गोइंग टू ईट रॉ मीट, और ऐसे कच्चा मटन फेंकते ही देखेंगे. ठीक है. नोबडी इज गोइंग टू गिव एग्स टू अ काउ फॉर प्रोटीन, एंड नोबडी इज गोइंग टू गिव रोटीज टू द लायन बिकॉज वी आर XYZ religion. Okay. Similarly, if you think of what dogs and cats were meant to eat in their native or in their original habitat, these are primarily carnivorous animals. Okay. Now, in the jungles, they must be eating rats and mice also. We can't feed them that. Okay. But can we come closer to feeding higher protein, lesser preservative, no grain, no dairy? I think most of us can manage this. So my recommendation is on those lines. Feed a species appropriate fresh food diet. That is usually the guideline I give people. And for our pets, we often don't know where to begin. So it's a good idea to work with a nutritionist. Even if you don't, there is enough and more information available on the internet as to how to move to a meat based diet. And typically, these shifts help us to a large extent in reducing inflammation, neurological issues, and skin issues in the pets. So that goes a long, long way to help the health of the animal.
Fair. Uh, can you give us some practical tips for pet owners? And can you share some commonly used homeopathic medicines? Like for humans, we keep some homeopathic medicines at home for common cold, cough, those kind of issues. So, are there some things like that for animals as well? Like everyday issues like anxiety or.
So we have a section on our Insta handle dedicated to this. We have provided links where you can buy this,
Okay.
but I'll cover it anyway. So for injuries, there are combinations available. For diarrhea and gut issues, there are combinations available. And skin ke liye, the other things you can do like calendula powder and calendula ointment, minor injuries, sprains, all of these we have listed, and if you wish I can share that with you and you can probably
Sure.
tag it in this as well. So those are common things that people can use. Eardrops also are options that we have.
Yeah, ear
available.
infections are quite
Very common in
Yes.
dogs, not so
Yes.
much in cats, but in
Yes.
dogs. Yes.
Okay. How can pet parents find a qualified homeopathy doctor for their
Go to my
pets?
website. But otherwise, you'll have to look around. Really, there is no repository which says which homeopaths are practicing for animals. Also, it is easy to say I practice for animals, but unless you've lived with an animal, you've handled animals, you've learned about them, the emotional side of this is not so easy. There is a lot of instinct that we work with. For example, in every single animal case history that I do, I will always ask about the emotional well-being. Who is there in the family? What's been happening recently? Often, we'll find stuff like a baby was born, and then since then the dog is not allowed in that room. Okay, so it takes some little skill that one has to develop to acknowledge these factors and then to also address them. So, to your point on how do you find a good homeopath for your animal, honestly, there is no answer. You'll have to go by word of mouth. There is no repository that will give you a list or something.
Okay. Does homeopathy work better when combined with things like diet changes, more activity, more exercise, or other holistic approaches?
That applies to any system of medicine, like it's not just homeopathy specific. Any treatment will work better if you do the necessary lifestyle changes that go with it. So that I think is not just a homeopathy specific thing, but of course we do invest time and energy in counseling patients about it. If today we also see that even if conventional medicine practitioners take the effort to coach their patients about these things, it tends to give much better results.
So, I'll give you a situation, a very specific behavior issue which I've heard in some small breeds, especially like small breed dogs. Uh, they are absolutely fine, but they start peeing inside the house only at night, maybe sometimes, but otherwise during the day they're absolutely fine. So, is that a behavioral issue, or is that something which may have a inherent disease?
Very little information to go with, but typically they are behavioral issues. And I find that in smaller breeds, bichare, they are handled very poorly. We treat them like toys. So my usual guideline to people with toy breeds is treat your Chihuahua or your Shih Tzu like it's a Great Dane. Will you pick up a Great Dane? No, na. Don't pick up your Shih Tzu also. Because imagine if I just came to you every time and just picked you up. Why would you like it? Right? It will make you irritable, snappy, your personal space is violated, it makes you anxious.
Right.
So I think it's not really so much about the smaller breed that is an issue. It is that the smaller breed is not handled the way, it is not given the respect and the space that it deserves. And often it is not the dog that needs to learn boundaries, it is the human that needs to learn the boundary. If you just pretty much leave them alone, they will calm down. So a lot of the times I have to use my inputs from what I know, having learned canine behavior. That is the input I'm using. There is no homeopathy to be done. Like if the dog is peeing at home at night, it's out of anxiety. Most of the times you are triggering an anxious animal, and address that and your dog will be fine.
Okay. What are the most important things pet parents can do at home in their daily lives, to support their pets' long term health?
Invest time, energy, effort, and create an ecosystem to provide the animal a good diet. It is not exactly easy to do it on a day-to-day basis, but it is very rewarding to do it. So find good meat suppliers. Of course, first step is that if you have religious or other inhibitions, and a lot of people do not feed meat out of reasons of animal cruelty. But like I said, I could be right and wrong. Nature में तो वो meat eating animals हैं. So it is an unending debate, but I am very clear on which side I am. So invest and create the ecosystem and the resources to provide good food. and try and provide a stress free environment on a day to day basis. Things like I was just talking about in terms of don't handle the animal too much. Don't treat them like toys or your possessions. They are sentient beings and they deserve their own space, and they also have temperament and nature of their own. Just like you and I may enjoy meeting and hugging every time, someone may not even want to shake a hand.
Yeah.
They are very similar. So if we respect that space, we are letting them be stress free. That, and be involved personally in your animal's care. All of us today live busy lives. We have working professionals. Can we hire staff to take care of an animal? Absolutely, we can. But at least can we be hands on with what is happening in their lives? Yes, we should. So those, I think, sort it out. This is not about homeopathy or allopathy or veterinary. This is just about what can you do today. If I get an animal, how can I provide the best care? I think by doing these things, you are pretty much sorted.
Okay. So you've spoken about it, but still, are there any specific cases where homeopathy hasn't worked?
See, I won't say it doesn't work, but relatively tougher to treat are distemper cases and kidney failure with creat levels above 5. Those are very difficult to reverse. And again, there are ifs and buts. Chronic kidney disease with values above 5, because if it is creat above 5 due to a renal stone or something, that can be addressed. But in the chronic issues where there is kidney degeneration, etc., the kidney is an organ that is difficult to regenerate, revive. We can manage, but we are not able to cure per se. Distemper again is a highly fatal disease in animals, dogs, and there, if I see patients with advanced neurological symptoms, it's very difficult to treat it. We are only able to help if we get involved very early. Okay. Or if this is as a breakthrough of vaccination or it is a mild case, then the chances of cure are there, or rather survival are there. In other cases, personally, I haven't had much success in treating distemper beyond a point. If it is early stage, yes, we are able to help.
And how about critical illnesses like maybe a cancer or?
We play a complementing role. Again, it depends, because see, in animals, cancer works or rather progresses very differently from humans. At least my personal experiences, there is no, I haven't seen too many slow cancers in animals. Usually, when it comes, it is quick to progress. Most of the cases. So we usually say if it is a lump or a single mass or something that can be removed, please remove it. We'll try and work on preventing recurrence. We'll try and help with post-surgical recovery. We In cases of lymphoma, however, we've had very good results. Some cases chemo has been done, other cases it's not been done. Both cases we've treated. Otherwise, if, and today at least in all large cities you are doing chemotherapy and radio and everything, we play a very good role in supporting the health of the animal through that, because chemo and radio have their own side effects, and we are able to help the animal. And of course, as in humans also, we do this. We help with the side effects of chemo and radio and help, therefore play a role in that ecosystem. But if you're asking me, do I treat cancer in animals standalone, I don't have the confidence to do it. Perhaps if I tried, I could, but I have never gone there.
Okay. What would you say to a pet parent who is very hesitant of trying homeopathy?
First of all, uh, look at the work we are doing. It will give you some credibility of what we are talking, because there are over 200 testimonials that we have now posted from pet parents, unedited. What they have sent, we post, talking about how homeopathy has helped their animals. Secondly, a lot of vets now work with us. That must tell you something about whether this works or not. And lastly, if you're still not sure, it's up to you. But if you're hesitant, but with an open mind looking for more information, these are the places to start.
Sure.
In terms of getting information on how homeopathy can help animals.
I think one issue is there's not a lot of information available on how homeopathy has worked on animals.
That is true.
Like,
Even lesser on how Ayurveda has worked for animals.
yes,
There is nothing available.
right.
And Ayurveda also, by the way, like it's not my system of medicine, but I have seen some cases where they involve in Ayurveda practitioner. Particularly, I know that in liver detox, Ayurveda works really well.
Oh,
So, but where do you start looking for this? I really, unfortunately, there is, as far as all alternative systems of medicine go, the information is scattered, not structured, and unfortunately also not credible.
hmm.
How do you, like, it's very easy for someone to just get up and say, I can treat XYZ.
Yeah.
But where is the credibility behind it? The the credibility comes from, and which is why, really, if you look at our Instagram handle, it looks like we just treat animals. This is actually not true. More than 50% of our patients are humans. But we tried to build a repository of credibility coming from pet parents only, so we don't post anonymous testimonials or anything, which is that we are giving you credible information that this works. Now, beyond that, does anyone want to go for it or not is really up to them.
Okay. What's a simple way for pet parents to start incorporating homeopathy into their pet's health routine?
See, if your animal is healthy, there is no need to incorporate any system of medicine.
Hmm.
Like I said, focus on the food and the environment. But if your pet is facing some issue on a recurrent basis, then yes, reach out to us or any other qualified homeopath who works in this space, and they will then guide you in terms of how we can help. Of course, we spoke earlier about small ailments like
Yeah.
injuries and diarrhea or ear issues and whatever. So those, if you can keep handy at home,
Hmm.
that is a good starting point.
So I have faced this issue with my dogs in terms of giving them medicines. Allopathy medicines I've usually crushed and given it in the food. But homeopathy, when those pills are there, how do you like? Should you crush
So
them
at
or
least
not?
for our practice,
Hmm.
we don't say that you don't touch it, whatever,
Ah,
whatever.
okay.
All those fundas I have forgotten about long ago. I am personally also a feeder of street animals.
Huh.
Okay, so I do not have the courage to go and not touch a pill and give it to a street animal.
Yeah.
So two, three options. One is you mix it in the food.
Hmm.
पेट्स तो घर में डायरेक्टली स्वीट पिल्स भी ले लेते हैं
Hmm.
आराम से. आई मीन वी पोस्टेड स्टोरीज अबाउट इट सो मेनी टाइम्स दैट द पेट थिंक्स इट्स अ ट्रीट एंड दे कम रनिंग बिकॉज खाने में मीठा है, दे डोंट नो इट्स अ मेडिसिन. बट otherwise you can dissolve it in water
Hmm.
and give it via a syringe like you give any liquid
Liquid.
allopathy
Hmm.
medicine.
Okay. If you could give one piece of advice to every pet parent, what would it be?
Focus on the food and adopt native breeds if you can. They have much healthier, much stress free lives for themselves and for you.
Okay. So, Ashma, how do you ensure the diagnosis is correct for when you're treating cases remotely and most all the animals you treat remotely only?
That's true. So, two parts to that question. One is diagnosis by definition means the naming of a disease.
Hmm.
In homeopathy, diagnosis has value, but more than that, the individual characteristics of a particular patient have value. So, we often say we treat a patient and not a disease. Okay, so what happens is, even if I don't have a confirmed diagnosis, I'm still able to treat based on the presenting symptoms and other information that you will give me. I can still address. This doesn't mean that diagnostics do not have a value. Where we have that information available, obviously we will use it. Okay, but if I don't have that information available, also I will still work. Having said that, we take into account when we do our consultations, it's a fairly elaborate process. We will ask you for reports, prescriptions, diet, pictures, videos, any imaging of the x-rays or sonography, CT scan, whatever is available. We will take this information from you and go through it prior to the calls, and over and above all this information, we will then do a 25 to 30-minute call with you to understand symptoms of the disease, the lifestyle and the behavioral patterns of the animal, including appetite, thirst, energy levels, and so on, and the emotional well-being of the animal, meaning who's there at home, um, you know, ha- is the animal okay to be left alone? Is there separation anxiety? Is there any other anxiety? Is the animal okay to be touched? Are they fearful of touch? And has there been any major life altering event for the animal? An example, we were speaking about it a few minutes ago. For example, there's been a baby born in the house, and the animal is no longer allowed near the baby or in that room, or so I have gone to the extent of seeing that the animal was put in a kennel outside the house. So those kind of things happen, and we must account for that when we think of disease. These factors play a role in the animal falling sick. So we take into account not just a diagnosis, but all this information when we treat. And now at least we have enough experience to say, okay, this is not adding up. Please go to your vet and get a proper diagnosis done. This is a very common thing that both I and my mother will tell you. If there is a clear answer available, great. If it's not, at least we will run the basic blood work and ensure that there is no major disease that we are overlooking. So this is the bit we try to do to compensate for the fact that we are remote and not with the animal.
Okay. What is your view on vaccination?
It's a complicated topic. There are a lot of homeopaths who are completely against vaccinations. I am not one of them. I am wholeheartedly in support of vaccinations for animals because the number of animals I have seen being lost to distemper or parvo or such disease simply because they were not vaccinated is way too many for me to ignore the benefits of vaccination. Having said that, I think there is some amount of over vaccination that happens in our country, and I am saying this as an informed citizen more than as a doctor, because if you compare our vaccination guidelines with that of other countries, even accounting for the fact that India is a lot more contaminated, polluted, whatever, we're simply over vaccinating our animals. And as we saw during COVID and its vaccinations, these vaccinations have side effects. They by definition trigger an immune response. That's the job of a vaccination, to trigger an immune response from the body. If you keep doing it way too many times, you will for sure see allergies, you will see skin issues, you will see other complications. So do you not vaccinate? Of course you can't do that. It is legally binding for you to vaccinate your animals. So I'm not saying that, but can we be at least cognizant of the fact that this can cause a side effect, and speak to your veterinarian on what is the best approach. In case of epileptic animals, for example, it is a better idea to do titer testing, which basically checks for the concentration of antibodies in the blood. And if the antibodies are existent, that is considered a valid reason to not vaccinate. Your veterinarian will give you a certificate saying antibodies exist and vaccination is not needed.
Okay.
So, of course, you would go to that extent only if your animal is unable to handle vaccinations, because some animals do get allergies also. Epileptic fits also can be triggered. So, take the best decision with your veterinarian. In a lot of cases, in senior animals also, they stop vaccinating after a certain age. I am not the right person to guide on a vaccination schedule, but all I will say is that know that all of us seem to think that if I deworm and vaccinate my animal, they will never fall sick. That is our duty as pet parents. But we must also know that these come with a little bit of a caveat. And as long as we are recognizing that this can also cause a problem, we'll at least be able to look out for it and treat it if it happens.
Since you mentioned deworming, how frequently should an animal be dewormed, or is it necessary? Because usually the vets do recommend that, at a certain frequency deworm your vets.
Catch 22 question actually. The way I look at it, not necessarily every time. And the example I often use is a human example because I'm a human doctor. I wouldn't deworm my human baby every 3 months. My dog and my human baby, I mean, I don't have a human baby, but if I had one, they would be eating food that is at par in terms of quality. Today I use human grade food for my dog. I am not
Yes.
using dog grade food. So I don't see that if my animal is not really going out in the open or, sniffing pee and poop or whatever, or getting some active source of worms, why should I deworm every 3 months? That's my personal thought process. But think of it this way, Manisha. If you had a cold, you would simply not go and inhaler, right? आप सीधा जाके वो तो नहीं करोगे. What you will typically do is आपको सर्दी हुई है, you will try to do steam inhalation. You will try to take हल्दी शहद काढ़ा ले लिया, ये कर लिया. नहीं हुआ तो आप कुछ फर्स्ट ग्रेड मेडिसिन लोगे, नहीं तो किसी के पास जाके एंटीबायोटिक लोगे, और वो भी फिर अगर नहीं एड्रेस हुआ तो वो स्टेरॉइड लिख के देगा. Now, similarly, in any disease, not just deworming, in anything, at least give the other options a try. Which is to, can I use a natural dewormer? Can I use a homeopathic dewormer? But if all else fails and I'm seeing worms in stool, please, the deworming medicine is there for a reason. But like I said earlier, do I want to use it prophylactically or preventively every 3 months? I'm not so sure.
What are some natural dewormers?
Pumpkin seeds are very good,
Okay.
I know. The others, I don't know. We give homeopathy medicines, which are dewormers, and eventually they are basically anti-parasitic medication. So they alter the gut pH a little bit. So that can be used. Even more relevant where you can't give deworming. For example, in case of epileptic dogs, chemicals are a huge trigger for epilepsy. So there you must avoid it. Very small animals, okay? Like I've had 200-gram monkey, 300-gram cat. What dose of deworming will you give to this animal? And you can see you can see worms in the stool. What do you do? So in such cases, opt for more gentler or natural methods, like say pumpkin seed is one, but homeopathy में हम दवाई देते हैं फिर to deworm.
Okay.
So my usual recommendation to people is either do alternate homeopathy and allopathy every 3 months, or do homeopathy if your animal is not going out too much. Do mostly homeopathy, and if you see any signs of worms in the stool, meaning either there is vomiting or there is diarrhea or there is scooting or whatever the symptoms of worms are, or if you're seeing worms in the stool, please go and use an allopathy dewormer and do that.
Okay. How did you get started on homeopathy for animals?
We had pets. Um, in my childhood, I'm from a town called Baroda. So both our pets were very commonly troubled with skin issues, and we kept applying steroid creams and this, that, and the other. And then one fine day, my mom is really the pioneer of this whole thing, and she said, "Why don't I try giving her Sipia or Rustox or something?" And it worked. And from then we sort of gradually started doing this, and at some point we put it on the website, and it just grew, from our patient base. It grew further into, today we are, in some cases we are primarily known as animal homeopaths more than even human. So it sort of grew very organically. There has been no trigger, so to speak. It's been a slow but organic journey.
Okay. I have another very common question that in India, usually pets, when a new baby is born or otherwise also, people are not so comfortable with pets in the house. Unlike, say, a foreign country where it's part of the culture over there. Mostly every household will have a pet. So why do you think we are so not comfortable with pets around?
I think it's a mix of environment and culture both. Look at, like, typical Indian household सोचिए अगर आप, तो हम उन लोगों में से हैं, मोस्टली हमारे घरों के जूते बाहर रखे जाते हैं, मोस्टली, है ना? क्यों करते हैं? बिकॉज वी आर अ डस्टी, डर्टी, sticky, humid country with a temperate climate of around 30 degrees. If you look at this from a medical standpoint, it is a very fertile ground for bacteria and viruses to breed. So in India, you do sweeping and mopping every day.
Yeah.
This is not the practice abroad, right? because ज़रूरत नहीं है. The environment is different. So one is that these are environmentally different countries than we are. Secondly, culturally भी अगर आप देखें तो animals had a place in Indian society, but usually they were outside the
The
house.
house, yes.
And they would be, our shastras, and even if you sit in a puja, they will talk about the crow and the cow and the dog and, these. So it's not as if they were disrespected, it's just that they were not a part of the family. So culturally, I think that is ingrained in the way we lived. Of course, we are no longer that society. We have evolved to become something else, and these practices must evolve too. So, to speak specifically to your point on babies and dogs, there is enough and more literature available to say that babies that grow up with dogs are actually healthier babies. Uh, but even if you do wish to have a boundary for the animal, they learn very well. Use baby gates. There are softer boundaries. It doesn't have to be a very harsh way in the way you do it. Also, to be honest, Manisha, the dogs that are kept outside the house, for example, in cases if you go for stables or dairies or many other places where you have guard dogs, they are not necessarily badly kept dogs. Okay, the only thing is don't be harsh to them and don't do this transition too quickly. Work, there are again people who specialize in canine behavior, and they can help you if you have a baby on the way. It's not going to happen overnight. You have a good 8 to 9 months to plan this out. Plan it and make it phased out for the dog, and take care of the dog like, or the cat, like it is your elder child. And if you have that mindset in place, you should be okay. Because look at it this way, even if a younger baby is born, the elder child usually does make some adaptation or adjustment. It doesn't necessarily have to mean bad things. It just has to be handled with some sensitivity and some expertise. And that expertise in households usually comes from the grandparents. But in case of pets, it may not necessarily be the thing. So you can work with behaviorists or people who will tell you that a baby and a child together, a baby and a dog together are not a bad thing. So can it be changed? Yes, and I think it's high time people try to change it.
Are there safe homeopathic options for teething pets?
Teething in pets.
Like very small puppies?
Yeah, of course. Calcarea fos is one of the most common things that is used for teething in babies also, by the way. We also give other medication like chamomilla and others, like depending on what symptoms are being shown. So if you just want to give support, calcarea fos 6x is a good one. But if you're seeing symptoms like diarrhea, or because that's again very common during teething stages, so frequent tummy upsets or behavioral issues, then a more elaborate consult and relevant medicines can be given.
Okay. Last one. What's the future of natural healing for pets and animals?
I think the potential is huge, because as people understand that conventional medicine comes with pros and cons both. It's not just the side effects or the cons, right? When you need quick results and when you need immediate care, allopathy or conventional medicine is life saving. So, a lot of people tend to say, I don't want to look at the veterinary option, I don't want to look at the allopathy option. I always say, you can't really do without it, because where the animal needs a quality of life, where you need to save the life of the animal, those medicines are relevant. But for a chronic, long term lifestyle management perspective, the entire world is shifting for their own personal care towards more organic and natural and healthier options. And this is only to follow for animals as well. Like, as you realize that pumping chemicals cannot help beyond a point, people will start looking for these alternatives, and they already are. So it is a natural evolution of that space, if you ask me.
Great.
Okay.
Thank you.
Thank you.